Thank you so much. I have no questions. You really covered the subject very, very well, and I thank you very much for coming all the way from Washington, D.C.
It's not that far. It's just a plane ride.
to come out here to give us the information and to give us an idea of how we might use policy to drive some of the issues that you just talked about.
Absolutely.
Thank you again.
Thank you. Appreciate your commitment.
Next, we have Karen Smith, Director of State Public Health. Haven't seen you in a while.
I know.
Welcome back.
Thank you. Thank you very much, Chair Brown, for inviting me to speak to you today. For the record, my name is Dr. Karen Smith. I'm the Director of the California Department of Public Health and the State Public Health Officer. I really appreciate the opportunity to provide you with some information about the programs at the department. I think you and the previous speakers have actually really covered the magnitude of the issue and the cost of the issue, so in the interest of time, I'll get right to the details about the programs that the California Department of Public Health currently administers. For 30 years, the department has administered two programs aimed at Alzheimer's disease. The first that I want to speak about is the California Alzheimer's Disease Centers program. The centers are a network of 10 facilities at California University Medical Centers, which are funded entirely by State General Fund. The centers were established by legislation in 1984. And they are devoted to a number of things, including evaluation and diagnosis of Alzheimer's and related disorders, professional training and community education about Alzheimer's disease, and providing resources for patients, families, and caregivers. California Department of Public Health provides the centers with funding, administrative oversight, and evaluation. The centers are located at UC San Francisco, UC Davis East Bay, UC Davis Sacramento, Stanford University, UC San Francisco Fresno, UC Los Angeles, UC Irvine, University of Southern California, USC Rancho Los Amigos, and UC San Diego, so some very prestigious institutions. There are many notable achievements by the centers, but I just want to mention three. The centers have provided education and training to almost 17,000 professionals and students since their inception, and over 14,000 family members, caregivers, and community members across the state. They've also contributed expert knowledge toward the development and publication of comprehensive provider guides, which are available on the department's website. The guides include educational tools and infographics covering disease detection and diagnosis, nutrition and physical activity for affected persons and with Alzheimer's or related disorders, and communications, support, and resources for caregivers. It's worth noting that the state funding that supports the California Alzheimer's Disease Center has also been used to leverage additional many millions of dollars in federal funding since the centers came into being. That has also helped to advance the research agenda. In 1987, 3 years after the establishment of the Alzheimer's Disease Research Centers, the Alzheimer's Disease Research Awards program was established in the Revenue and Taxation Code. The code authorizes taxpayers to check a box on their state income tax return, and by doing so, make a contribution to research on Alzheimer's diseases and related disorders. These taxpayer contributions fund the Research Awards program. From 2010 to 2015, donations have averaged $455,000 annually, and I think that speaks to the fact that the general public in California really understands the importance of this issue. The grants are awarded in 3-year cycles, and for the cycle from 2013 to 16, we awarded $1.46 million in 5 awards. In the current cycle, 16 to 19, as you just heard, we've just completed the awards, and we have made 7 awards totaling $1.68 million, so we've been able to increase the funding a little bit. Since 1988, the contributions from California taxpayers to Alzheimer's disease-related research has totaled over $10 million. The funded research projects have contributed significantly to our understanding of Alzheimer's and related disorders and their impact on patients and caregivers. To better address the rising prevalence of Alzheimer's disease and associated strain on families and services, the 2016 research grant cycle focuses on 4 primary areas of study. And I want to mention as well that our advisory committee has really helped us tremendously in deciding what those focus areas should be. So they are early detection of disease, risk factors for disease and prevention strategies, disparities in health outcomes in people with Alzheimer's in different populations, and the economic and social impacts of caregiving. As we move into the future, the department will continue to track both the epidemiology and the developing science of Alzheimer's and related disorders, while we continue to work with our partners in identifying opportunities and new avenues in which together we can better address this devastating public health challenge. I'd be happy to answer any questions you may have.
Thank you, thank you, thank you. And you've given us a lot to think about. The question that I wanted to ask is, how did you increase? You said that so much money came in through the checkoff. Then you said, well, we increased it. So how did you increase
Just
that?
cycle over cycle. So the money that came in the account was greater, and therefore we put out more money.
Oh.
So it's not, I think that what that tells us is that interest is growing as well.
The other thing I wanted to know is, are there any community-based projects that you fund with this, with the extra money, or?
I would like to introduce Dr. Carolyn Peck, who has much greater technical detail on exactly the nuances of the program in terms of things like local community efforts.
Yes, in our recent, good afternoon. In our recent...
Please give us your name.
Caroline Peck.
Thank you, Caroline.
Happy to be here. Thank you. In our most recent awarding of the research awards, we do... I have the list here, which I'm happy to provide to you. And, for example, we gave one to the Public Policy Institute of California, and we also awarded a consortium grant to the University of Southern California in consortium with the Family Caregiver Alliance and the National Center on Caregiving. So the research awards are not just limited to the university setting, but we also want to get money out to the community to the extent possible. With our 10 Alzheimer's disease centers, they have strong ties to the community-based organizations in their regions as well.
And that's particularly true in their development of caregiver materials and education for professionals that help them talk to families of people with Alzheimer's.
Well, thank you so much. Thank you. Well, this brings to an end this particular hearing. However, if you'd like, I will take time for public comment. I think it's really important that the public has an opportunity to speak about this issue and about any issue that government's dealing with. So if you'll please come to the mic, you're welcome to give comments. Okay, let me ask Karen, Dr. Smith, are you still here? Okay, could someone get Dr. Smith, because I want to take a group shot, a group picture with the participants? Yes, either where. She can sit. They can sit anywhere.
Hi, good afternoon. My name is Angelika Pite, and I'm working for about 10 years with people who have Alzheimer's, and I'm the director of an adult day program. And what I see actually, that adult day programs of a social type are really not enough in the state. So we have like in my area where I live, this is the Inland Empire. It's an area which is greatly underserved, and we would need much more of those day programs in order to relieve the stress of the primary caregiver, and also we can actually effectively decrease costs, because when we take those people into day programs, often the placement has to occur much later.
So you said you're from the Inland Empire?
Yeah.
What city are you representing?
I live in Riverside, but I work in Claremont.
Ah, okay. I just wanted to see if it was my district. It's still the Inland Empire, but it's not my district. Next.
I'm Caroline Daly. I'm from Lemoore, California. My husband had to retire because he had Alzheimer's. He was 59 years of age. Wow. So that's early onset. He, because of his age, his income, of course, was cut. Our expenses became more. He eventually had to go to adult daycare, which I drove from Lemoore to Hanford, which is 10 miles. So I would drive there, drop him off. They would take care of him. I would drive back home. And then we did that for 2.5 years. In the process of doing this, I went before our city council and said, we need one in Lemoore, because there were people in Lemoore that were needing of care. And I told him, I said, if I was 85 years old, for me to get my husband ready to go to daycare and drive the 10 miles, I would just say, forget it. So they did get an adult daycare going. He never was able to use it because the last 5 years of his life, he wound up in an assisted living. He's been gone 6.5 years. And because of his age, we did not get long-term care. He didn't qualify for Medicare because when he got to be of age, because I was working, that didn't apply. And so I have family and friends that have been touched by Alzheimer's, and their ability to pay, it is expensive. One of my friends just said $8,000 a month for his wife to be cared for, and the long-term care had run out. And things like that, I mean, we were able to manage, but not everyone. So, anyway.
Yeah, thank you so much. I'm so sorry. I do know what it's like to go through that, because my grandmother died of Alzheimer's, and I couldn't, the last few years, couldn't take care of her because she would run away. So I had to have her in a locked facility.
Well, I got him one of the safe return bracelets while he was still at home, but he told me, if I walk around the block, I know I'll get lost. So at least I had that going for me. And I had me a bracelet, because if I was out and I was in an accident, someone needed to know that I was caring for him. And so thank you for your time.
That's a great idea. A bracelet so that someone would know that he was at home by himself, or that's a great idea.
Yes.
Thank you.
Yes. And the adult daycare is still going, and I go by. It's
close to your heart.
Yeah. But even though he wasn't able to use it, I know that there are families that still are. Thank you so much.
Thank you.
Thank you, Assemblymember Brown, for holding the hearing, but also for all the support that you've provided to caregivers and families with Alzheimer's disease. Provided you a postcard of my family. We've been on a 7-year journey with Alzheimer's disease and other dementias. My father passed away 2 years ago of Lewy body disease. My mother is in the late stages of Alzheimer's disease. And a few months ago, my mother-in-law was diagnosed with Alzheimer's. So the journey continues on. Like many family members, it's emotionally, physically, and financially draining. My parents built a little nest egg for themselves, and fortunately, it took us through 7 years of care. But last year, in November, we ran out of money, and my mom is now in custodial care. And that was a very difficult decision for us to make, but it was something we had to do. We needed to be able to provide care for her. And I sit there and I was listening to Randy, and so many of the things that she was saying really are captured in this picture of 2/3 are women, in the picture. The cultural component of being Latino and Asian, which my mother-in-law is, the whole caregiver journey and how difficult that is, and how much lack of support there is out there for caregivers. And then the cost, it's astronomical. And when you think of the nursing facilities and care provided there, that just adds a different level of stress, because you have to stay on top of that as well. And my mom lives in the Bay Area. We commute there. Somebody is at the nursing home every single day. We're still paying out of pocket to have our caregivers show up for a few hours every day. The costs don't end, even when they're under custodial care, if you really want your family member cared for.
Thank you.
Thank you for everything you're doing.
And I think you brought this to us last year and
I
year
have a
before
different card
last.
made every year, so now we've added my
I should
mother-in-law.
get my collection because I do have it. So thank you. I know I know your family very well from the cards.
Thank
and
you.
I think one year you brought one of them here
Maybe my mother.
when Ms. Yamada was the chair.
Yes.
I do believe. So
She's
thank
still
you.
a champion.
Yes. Oh, she is. Thank you.
Thank you.
Sir, your name, please.
James Savoy. I'm from the Inland Empire, Paris area.
Oh, good.
I want to thank you for sharing this, chairing this position that you have on long-term health care and bringing out the issues of caregivers. 2014, my wife had an aneurysm, and she reduced to a vegetative state. And for the next 7 years, 11 months, and 25 days, I became a caregiver. And all of the issues of a caregiver was brought to the forefront, and my life was forever changed. Needless to say, she was 55 years old, I was 57. Wow. The system that I found was very inadequate of caring for a brain injured person. And there was very little out there in the form of resource, and there's little help as far as what the caregiver can expect and what they know. We started a nonprofit organization called SHARAC, and what it is about is to bridge the gap between alternative treatment and conventional care in order to get a caregiver and the patient the best support necessary in order for them to do the best job possible. Because sooner or later, each and every one of us is either going to become a caregiver, employ a caregiver, need a caregiver, and it's an awesome responsibility to learn once you get to that point. To sit there and watch a person at 55 years old, for the medical system to say there's nothing could be done for them, it leaves you in a very bad situation, because the only thing else that's left for you is alternative care. And with the way the state and the medical system look at alternative care, most of those remedies is not supported. So financially, it comes from the household. If we don't look at exactly what's fitting to happen to us as a nation, the baby boomers fitting to hit this system, most of them is equal in age, there's going to be at least two persons in every household and a caregiver that's going to have to care for them. So our organization is set up in order to give the necessary assistance, legal, education, financial, and whatever other training that's needed. So I really thank you for bringing this to the forefront. It was a battle for me for 8 years, and I didn't find no help.
Thank you so much for your story. And as we talk about these stories and as we think about policy, if anyone wants to write me and tell me what a good bill will be, we'll definitely look at it, take it to Ledge Council, and see what we can do about it, because it comes from you, the community that has to deal with the whole event, the whole thing that's happened to you. So thank you very much for coming. Next.
Hi, my name is Minga Futrell, and I'm a Sacramento resident. And Alzheimer's has touched my life. Unfortunately, I have to report it's touched it twice. When I was 50 years old, back in, my mother was contemporary with Ronald Reagan, and so I had my parental experience of caregiving, and I am presently, my husband was diagnosed in 2010, and so he shifted from being a caregiver of my mother to now being the person that I care for. I want to talk about the hidden costs, because And it's not just that the baby boomers are coming along. It's that the state doesn't really recognize the actual costs of this disease in spite of the fact they are reported. For example, in my situation, my husband and I, when my mother was diagnosed, although they didn't know how to diagnose then until after death, and she did donate her brain, and so therefore I do know she actually had Alzheimer's. But my husband and I closed our business, and we had an employee, and so the state knows nothing about the fact that we closed a business here in Sacramento. There was a computer training center, and that was when I was around 50. That's not the time when you really want to go into caregiving, family caregiving. And so I came in 2000. I came back after my mother died and established a bit of a life. And then my husband, now I'm in spousal caregiving, and for which is an order of magnitude as you lose your partner in life. But when I talk the hidden costs, the state knows nothing about this. My resources are dwindling away because I want to provide the care that I know he needs. I want to give him daycare. I want to give him what he deserves as my partner in life. But so far, you don't know any of the things that I've spent. You don't know the taxes that I haven't paid because of the situation of my change in life. So you also probably don't know that Alzheimer's is the reason a lot of people die that's not reported by the coroner, because people end up with something else that was, pneumonia or whatever that's not reported. And then you don't know about these orphan elderly that are coming along. We talk a lot about family caregiving. Well, I have two friends who are 70 years old. Neither one of them ever married. There is no family for those people. So where do we look? We look to our government. And so I think you just need to sort of help us by thinking about all these variables that impact on changing people's lives that are touched by Alzheimer's, because you won't find the person who had it coming back to testify. They don't do it. So think about us, and we'll think about you. And I do appreciate your holding this hearing.
Thank you so much. I know when Dr. Bredesen came to my district, I still hear from people that want to be a part of his work that he's doing there at UCLA and some other place. I can't remember. He didn't talk about it much. But I know that it's a need, and I know there's a problem. It's just, how do we solve the problem? And I need all your bright minds to be there, to meet, to talk about it, to say, what would be good policy? One of the good policies that we didn't fund this year was adult daycare. To me, that is just a no-brainer. You give the caregiver a little bit of, you give them a little bit of respite. But that did not get in the budget this year, and I asked for it. So help me, and next year we'll ask for some other things, and we'll ask for whenever we have our senior rally day, you bring it to us and tell us what you want, because I'm not here for me. I'm here for the state of California and the community that I represent, and that's all of you. Oh, we have one other person.
Hi,
I'm sorry.
Nope, you were saying wonderful things. I'm Dr. Marcy Johnson. I am the administrator of a California Alzheimer's Disease Center in Fresno, California, UCSF. And I wanted to speak just a moment about the grassroots efforts and the community outreach efforts that our center is doing in conjunction with the Alzheimer's Association. And we're very excited to have an office now in Fresno with the Alzheimer's Association. UCSF Fresno Alzheimer and Memory Center has been around for 26 years, but we do not have a marketing budget. budget. So folks still don't know about us and the good work that we do. And the important thing for you to know is that we partner a lot with our social service agencies, our law enforcement, adult protective services, and I think there's going to be a large fiscal impact. I think there already is a large fiscal impact on these services in our state in serving our dementia population. I also want to make sure that you're aware that the California Alzheimer's Disease Center in Fresno trains and educates over 30 medical students and residents each year. Many of those folks, new doctors, stay in the Valley, and we're very proud of that and offering them superior geriatric education. I've loved wrinkles since the time I was 4, my mom tells me. I've worked in the field of geriatrics for over 25 years, lobbying and for elder abuse awareness and prevention, and now working in the field of Alzheimer's disease care is really where I started as an activities director. So I've worn a lot of hats. I believe in making this world a better place to age in, and so I just want to make sure that you are aware of the amazing community outreach efforts that we have done now with the first Latino Alzheimer Caregiver Conference, all in Spanish, in the Central Valley. That just happened. We reached over 102 folks, came to that. And we partnered with the California Valley Caregiver Resource Center and the Alzheimer's Association. And we also do a caregiver and wellness conference, and our first one reached out to over 175 attendees. So we have a lot of work to do. Our center serves Modesto to Bakersfield and over to San Luis Obispo County, so with only 2 full-time staff. And as you know, our budget was cut by 52% in 2009. So, of course, we would always want that back. But we do have a lot of work to do. We have a huge population to serve, but we do appreciate the partnership of the Alzheimer's Association. Thank you so much.
Thank you. And we did give the caregiver resource centers more last year. I think there was a little bit more this year.
Yes.
It's one-time funding. I think everything is one-time funding this year. And that's because the governor says we're going into another cycle where it's going to be a downturn. So we need to be mindful of that. But you can take as I understand it, you can take the resources that you get one time, and you may be able to spread them out through multiple years. So that's a good thing. Thank you. And I'm glad to hear about what you're doing in Fresno, and especially with those students, because that was one of my concerns some time ago. Mm-hmm.
Hi, good afternoon. My name is Carolina de Soto, and I'm with Fresno. And I want to thank you very, very much from the bottom of my heart for having this hearing, and also for the magnificent vote that you did for passing our bills this year, this budget. And I would love to beg you to please continue the good work. We need you so much. You are our elected officials. We need you as leaders to provide help and services to our loved ones. This disease is terrible, it's fatal, and we need to have all of us, these purple ladies and men that were here today, is because we need to have survivors. Please help us, okay? And that's all I want to say. And I thank you again for your time, and keep voting yes for us.
Thank you.
Thank you.
Was that it? We're going to close out in a second, so you'll probably be the last person.
I better speak then. Stella De La Pena, also in the Fresno area, in a staff with the Alzheimer's Association. But I'd like to speak to you not only as a staff member, but as one of your constituents, and share my personal story, what brought me to the Alzheimer's Association. And I was one of those individuals who did it all wrong. In 2008, I lost my father to Alzheimer's disease, and I knew very little about the disease. So made a lot of those mistakes that sometimes a lot of our families make because we don't know. We don't know the difference, and we associate it maybe with something else that's occurring with our aging parents, right? And so education, key and very important to me, very close to my heart, because I know that now that my mother is starting to have some memory impairment, and I'm seeing those signs, we're doing it very differently, all because of the education and the awareness that we now have. So I thank you for this hearing. I thank you for the opportunity to speak and to hear from your constituents, and for your offer to spearhead some additional efforts to help bring more awareness to this disease, to help us move this further along so that we can have survivors, so that we can make a difference between all of those families who don't know what to do, who don't know about the disease, so that they can impact not only their own lives, but the lives of their loved ones. So thank you.
Thank you. What I'm thinking after hearing everyone is that we need an effort to cure Alzheimer's. Think about it. They cured HIV/AIDS. I mean, not cured it, but they came to a point of where now people live longer with it. So they were looking for the cure. Why can't we start talking about that issue in the same way? Not to say we're going to accept Alzheimer's as no hope, but let's give it some hope. Let's give it a face. Let's say, this is my mother, this is my grandmother, this is my father, this is my friend. And let's give it a face, because whenever it becomes your own, people change the way they do things. And in this building, it has to become something for everyone, not just me, but for every one of my colleagues. And so if you can come up with something that we can do, I'm there for you. I thank you so much for being here. I thank you for, being here to finish out this hearing. And before we go, I would like to get the participants. I want to get a picture of the participants who were speaking. So, Randy, Dr. Bredesen. Oh, I'm supposed to adjourn now. This meeting is adjourned.